Welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. I'm Dr. Daniel Ronel, here with my wife Betsy Ronel.
I haven't left yet.
We just talked about, what did we talk about?
For goodness sake. We talked about the AMA program. I'll go over that one really quick last time.
We talked about...
Wait, can I say one last time? They've asked us to do this for them. So the AMA program, ama.org, AMMA.org. She will be here. She is known as the Hugging Saint from India. I'm sure you've all seen pictures of her somewhere or other. Anyway, this is her. She was the recipient of the United Nations Gandhi King Award, which is a huge, high honor. And she hugs everybody. Whether you're pretty, ugly, mean, nasty, she'll hug you. Mean, nasty, same thing. Nice, she'll hug you.
She's a great humanitarian.
She judges no one. So come on down. If you need a little love, she'll give it to you. She'll be here in Albuquerque on June 20th and 21st. These are free public programs. I do not have the times, but if you go to the website, ama.org, AMMA.org, you can find out the times there. There is free childcare, and it's actually a lot of fun. So I highly recommend it if you've never done it.
Good. Uplifting.
Yes, at the least.
Today I did a breast augmentation on a patient a few months ago. She's flying to Hawaii for her annual trip. And she's the third person who asked me this question. There's a show on TV, apparently on Tuesday nights, called 1,000 Ways to Die. And
what channel is that?
I've
never even heard of this. I know the book, I've just never heard of this.
Apparently in one of the episodes, a woman who just got breast implants, she goes up in the air and they explode, and she dies.
Where did they see this? On YouTube? I mean, what is this?
And so I asked my staff to Google this, and I did see it on YouTube. It's a TV show, but somebody filmed it. It's on YouTube. I'm not sure. I think that's not going to happen, okay? Don't worry if you have breast implants.
Call the FDA if you're concerned. Do not hold us responsible. I don't want to hear it.
Right. It's just that it's just a gimmicky thing that they did for the show. But please don't worry. You know, I thought it was kind of ridiculous, but this is the third person who's asked me about that. And no, your breast implants will not explode if you go.
How did they make that?
I mean, as we speak right now, there's probably 5,000 people in the air right now flying around with breast implants.
I've been in the air.
Ain't
nothing happened.
Right. So there's nothing to worry about. It's fine.
Wait, can I just ask you something? This stupid video on YouTube?
Yeah.
What does they show? Giant bosoms exploding in the air?
Yeah,
the nipples flying off into somebody's eyeball? I mean, what is that?
Now, all their episodes are, reenacted by actors. And so they showed, women's chest going bigger, and then all this blood everywhere and people screaming.
People really believe, I mean, you have intelligent patients. They really thought that was true?
No, it's on TV. It must be true.
I don't think they believed it. I think they were just like, now wait a minute.
Okay,
let me double check.
Right.
Because your patient base is bright.
Right.
So, but anyway, for those of you who really do believe it, I got a bridge to sell you too, by the way. I'll tell you right where it is.
So that's it. Breast implants are safe to travel with.
And if you're concerned, contact the FDA website and the American Society for Plastic Surgery website. Okay.
There's another thing that's become quite popular is dimple creation. We mentioned this before on the show, but
a while ago,
I don't know why. All of a sudden it's becoming very popular. I have a patient who's flying in from Seattle to have her dimples, and then she's flying right back the same day. It's a little office procedure, and in many societies, a dimple on the cheek is considered a sign of wealth or high social status. It really is. And
is this woman American? What is her
I think
nationality
she's Asian Indian, from India.
And in India, is this considered a sign of?
I've seen it. It was this technique was actually described both in the United States and in India at about the same time. India, by the way, has done a lot of pioneering plastic surgery.
I love the country of India. I really do.
Anyway, and so it's a simple office procedure. You numb up the mouth, make a little incision inside the cheek. We line everything up, and you sew the ends together, and right away you have a dimple. And it's a permanent.
You're puckering the outside from the inside.
Right. And it's a permanent dimple for about 2 weeks. It's always there. And then after about 2 weeks, when things relax, it just occurs when you smile. And it's a very effective technique. It's very nice.
How did you come about this technique?
I heard about it and then researched it and read about it. And it's not dissimilar to other things that I've done in the mouth before for people who have oral cancers. And you have to cut out a cancer, you have to use a flap of tissue from inside the mouth to cover the hole that you just removed with the cancer. So you know, if you've done oral surgeries before, it's not a very difficult technique, and so, well, that's a nice little office procedure.
I mean, I've had people who, when they see like my debit card or my credit card that I'm paying for, they like, are you related to Dr. Ronel? I happen to be the woman behind Dr. Ronel. Yes, the woman running the show, cracking the whip. And so some of these young things and not so young things have said, he did this for me, and they point to the cheek, and I'm looking at them thinking, what? And then I pause, and they're like, my dimple, see? And then they smile. I'm like, oh, really? You know, he talks about these dimples, and I have no idea what he's saying. You know, but clearly you're happy and they love it. I think in this country, regardless of spiritual, cultural, actual background, perhaps it's a sign of youth. I don't know.
I don't know. Well,
Everybody
like
loves
dimples.
a baby with dimples, for
Yes.
example. You know, they love kids with dimples. It's always been something I've always heard.
Absolutely.
Oh, look at his dimple. Or boys with dimples. Do men? Who gets this procedure more? Women, probably.
Women do, right. Another little office procedure that's coming up is hand rejuvenation with Artifil. So we're moving the study along. I'm doing a
He's
study.
head of the study.
There's
Good fellow.
3 doctors, one in New York, one in
LA.
right near LA, right near something beach,
Okay.
and me. And what we're doing is we're injecting Artifil onto the back of people's hands, because you can really tell somebody's age by
Yeah.
looking at their hands, and it just turns it into a nice, soft, sort of plump hand. And we've been using Radius for this for a long time, and now we're just studying the use of Artifil. Artifil would be nice because it lasts so long, so you don't have to keep coming back to do it.
Yeah.
And that's a quick office procedure, it's painless, and it's
Do you
got
numb
immediate
them up?
results.
Doesn't
Yeah.
that hurt?
No, not really. There's not that much sensation back there compared to the lips, for example. So that's coming up. And let me think, what's another little office procedure? Gina, can you hold it for a second?
Sure.
You got that thing.
The
We
lip.
mentioned that, right?
Yeah, he said a long time ago.
All right.
Let's talk about it.
Okay. All right, fine, I did this
Do it.
yesterday. And that's a quick office procedure, it's painless, and it's
you
got
numb
immediate
them up?
results. Uh-huh.
Doesn't
Yeah.
that hurt?
No?
I have a comment
Not
to
really.
make
There's
on
not
that, and then
that
you
much
go to the next
sensation
one.
back there compared to the lips, for example. So,
Right there.
sensation back there compared to the lips, for example. She wants to say something.
Okay. We're at 6:48.
All right.
You know, I've actually seen women who have had it done, and it's a huge difference.
Mhm.
It's amazing. I happen to like the way women, when they become an adult, like in their late 20s, early 30s, the way their hands sort of looks, it gets a little more defined and the baby fat is gone, and
Yeah.
I find that attractive. But I guess, I mean, I look at my mother's hands, and when you get into your years, it does. It looks bony, the arthritis shows up more, and the veins show
and
up, right?
tendons, right.
So I can see that in an older person for sure.
Gina, our producer,
Gino's checking himself.
Look at his
Do
hands.
men do this? That brings up a good question. Do men do
Sure,
this?
sure.
Because you men have thicker skin.
Yeah, they do, so
You
it's
know.
not.
That's obvious. But yeah, it makes a huge difference.
Here's another thing that
Yeah.
I just did yesterday.
Another in-office procedure quickie.
A quick lip shortening technique. A lot of people have a very long distance, for those of you on YouTube.
Your father has that.
Right, the distance between the nose and the upper lip is really long, and you can do a subnasal resection. You just sort of shorten the upper lip, and what's really nice is it curls up the lip, makes it look a little plumper, and it gives you what's called the incisor show. The aesthetic ideal at rest is to see about 2 millimeters of your front teeth, your incisor show. So
So
that's,
it's a lip lift.
there you go, a lip lift, yeah.
There you go.
All right, well listen, thank you for listening.
Next
you
week
to our-
the show will promise to be more interesting.
Okay.
Okay.
And this is Dr. Daniel Ronel. You're listening to the Humanity Behind the Vanity on Talk 1260 KTRC.
We'll see you around Santa Fe.